Okay, let's get started. And anyone who joins us late will catch up to us in a minute. So hello, everyone, and welcome to another webinar presented by the Multifaith Alliance for Syrian Refugees. I'm Allison Logie, the Manager of Interfaith Outreach here at MFA. I'm so delighted that so many of you can join us today. In just 1 minute, you'll hear from MFA's COO, Bennett Gross, who's going to give you a brief overview of MFA's role in a new channel of humanitarian aid. And then Dr. Elliot Goodman, who will be representing the work of Ziv Hospital in Israel. After Elliot has given his presentation, we're going to open this up for Q&A. We have a rather large group today, but I really hope that people won't be shy about asking their questions. You can ask questions in two ways. You're going to see a dialog box from GoToWebinar. It's most likely in the upper right hand of your screen. And along the side of it, there's a bunch of different icons, and you should see a hand icon. If you click on that hand icon, it will show me that your hand is raised. And so then during Q&A, I will unmute you. You can ask your question. If you've raised your hand and then you find that your question is answered during the presentation and it's no longer relevant, just press the hand icon again and it puts your virtual hand down. There is also a chat box that you'll see where you can type in questions. I will say that chat box is a little finicky and doesn't always work as well as the raise your hand function. So raising your hand is preferable, but if you want to try that chat box, then I'll be on the lookout for questions there. So now I'm going to unmute Bennett Gross, MFA's Chief Operating Officer, and he will talk to you a little bit about our new channel of aid. Go for it, Bennett.
Allison, thank you very much. Let me start off by saying how honored I am to be sharing the microphone with Elliot Goodman, whom I've known for about 6 months. Aside from having a charming British accent and amazing stories about what's going on in Ziv Hospital, I must tell you, since you can't see him, he's also devilishly good looking. So that part of it you're going to miss. We thought that while we were talking about Israel and its involvement in providing Syrian relief through Ziv Hospital, we could take a few minutes to fill you in on what we here at MFA are doing and what we've been doing actually for the past 2.5 years or so in creating a new channel of relief for bringing humanitarian supplies into Syria via what I can only describe as groundbreaking partnerships between Syrians and Israelis. It's really quite a story of vision and perseverance, and basically just a refusal to ever take no as an answer. I can speak about it this way because it was all done before I arrived, and I'm just very proud to now be part of it and be pushing this forward. Just by way of quick review, I think most people on the call have a good sense of what is going on with regard to the crisis created by the civil war, that 12.2 million Syrians have been displaced and 6.5 million people within Syria have been forced from their homes. So there's quite a need. Now we talk about Syrian refugees, but there's quite a need among people who are not refugees, those who are not technically refugees, those who are still in Syria. And it was those people that MFA was looking to help. Our involvement really began in the very earliest days of MFA back in 2013, when we realized that there was a lot of work being done by both Syrians and Israelis to deliver aid. We learned of, in particular, a lot of under-the-radar work being done in Israel to send relief through the northern border, the Golan Heights, into Syria. And it occurred to our founder, Georgette Bennett, that Israel could actually be a very effective staging area for humanitarian relief, that there was an opportunity really here not only to deliver relief, but to have an historic breakthrough to get Syrians and Israelis who were both delivering aid separately to work together. So with that insight, in 2014, MFA began what was a back channel effort the last 2 years to try to bring this insight, this thought, this vision to fruition. So in 2014, we started really speaking very broadly to people in a wide array of areas, to European Commission agencies, to European capitals, to the UK Parliament, to really promote the work of the Syrian NGOs and what they were doing to deliver relief to Syria. We also started forming connections, and it was the very, very beginning of a network we started forming with Syrian NGOs and people who could share our vision, could see an opportunity to deliver relief and the opportunity for doing it through Israel. So in that regard, we met a Syrian business person who became central to our work, who shared our vision, saw the opportunity here, and was also able to influence others, and of equal importance, provide some funding for us to support this effort, to begin to hold meetings and talk to people about it. That was 2014. In 2015, we then began, we continued this effort and began talking to people in Israel. We met with Israeli ministries, shared our vision for using Israel as a staging ground for a place that where relief could go and be sent securely into Syria. I must say at that point we were met with some skepticism. There was some doubt whether Syrians would be willing to work with Israelis. There was also some concern about whether there could ever be an international commitment, whether there was too much skepticism on the part of the international community as to whether this could be done. Nevertheless, as I said, not willing to ever take no for an answer, we continued to push. And happily, in September of 2016, almost 2 years after we had started this effort, we hit pay dirt. Israel adopted what it called the Good Neighborhood Policy. And in that policy, it said that it would actually work to deliver aid through Israel to Syria. This was precisely what we had been talking about for 2 years. And at the same time, a high-level officer from the IDF, the Israeli Defense Forces, contacted MFA and asked if we knew any Syrian NGOs that would be willing to work with us to deliver aid. And obviously this was the opportunity we've been looking for. We jumped at the chance, moved very, very quickly, and by October 2016, more than a month later, we were readying our first container to send to Israel. This was a container prepared by a Syrian relief agency that was sent to Israel, to Haifa specifically, that was then picked up in Haifa by an IDF truck, driven across Israel by the IDF, taken to the Golan Heights, where it was handed off to a Syrian NGO for distribution in Syria. So this was one 40-foot container of food, clothing, and blankets, greatly needed relief, but the real historical significance of this was this partnership, that it was Syrian NGOs delivering goods to Haifa, where it was picked up by the IDF and brought across the border. This was really groundbreaking stuff. Israel and Syria have been at war for 70 years. As our Director of Humanitarian Relief, Shadi Martini, has often pointed out, that just mentioning Israel in a conversation in Syria was enough to stop discussion. People just would not even consider working with Israelis, and here it was happening. After some 2.5 years of work, we were able to bring these parties together, and really in a groundbreaking historic relationship, set a new paradigm for cooperation. The hope here was that this could really be expanded, and we could move to create an ongoing series of containers that would go into Israel. Since that time, I'm happy to say we were able to do exactly what we hoped. We've now sent 11 containers with some $22.6 million of aid, including food, clothing, medicines, medical supplies, and medical equipment, and even 2 ambulances into Syria. What's particularly important is the way we go about doing this. We have partners on the ground in Syria who are identifying the precise needs. And when you look at some of the lists, they're incredible. I mean, it's down to a particular type of syringe, a particular type of breathing apparatus. We're told exactly what the needs are, and then we and our partners go out and find that need. This is not like going to a garage sale and just picking up whatever we can find and sending it to Syria. We get a precise list of needs on the ground, and we look to fill it. The other thing is that we've established an incredibly broad coalition that is helping us with this. We have our partners on the ground. We have Christian, Jewish, Muslim, and secular groups that range from large established organizations, international church groups, down to ad hoc community groups on the other end that have heard Shadi speak, been inspired, and are now putting together a container of relief. So I think this really shows that, you know, what MFA was founded on was this idea of shared humanitarian values, that all great faiths have this concept of caring for the other, for the outsider, for those in need. And to me, this is the best possible, most tangible proof that that these shared values can be made actionable, and we really can see the results. And I'm also pleased to report that nothing succeeds like success. The fact that we've had these 11 containers go through, that we've delivered $22.6 million of aid, has really motivated the partners. And we're taking on even greater projects. So we're in the process of refurbishing a hospital just inside Syria. The electricity, the water, and the fuel will be supplied by the IDF. There are bias-free educational tablets that have been supplied by one of our partners to Syrian children whose educations have been disrupted, so they can continue with the educational process. We're in the midst of working with a very large media outlet that has broadcast throughout the Middle East to develop a balanced TV series. And we're even now working on helping to get funding and supplies, equipment for a bakery that will be on the Syrian side of the border that will produce 15,000 loaves of bread a day, supplying both food and jobs. So we're very, very proud of what's going on and very enthusiastic about the future possibilities, not only for the relief, but also for these partnerships, for them to grow, to become a model for the region, and really a source of greater stability. The other thing that we wanted to also let you know is that we're now, and you can see this on your screen, is we're in the process of devising a fund-to-container program. What we will do, we're still working out the details, but basically for something in the vicinity of $5,000, and we're still working on the precise costs, organizations or individuals can fund a container. So we and our partners will determine what is needed on the ground. We'll find the source of supplies. We'll allow you, your organization, others, by paying $5,000, you can actually, quote, own that container. You can pay for the shipping, and it will be shipped across by freight to Israel, taken over the border, and you can watch the progress on our website as it goes from packing to being put on board a ship as it's going for the ocean voyage, all the way to Israel and then ultimately to the Syrian border, and watch the progress of your own container. So we'll be announcing the start of this probably in the next few weeks. So if this is something, you know, I'm very proud of. For me, this was one of the reasons I joined MFA back in January. I thought this was a fabulous process and program. To me, this is what MFA is supposed to be, and what humanitarian relief is supposed to be, that we're not only serving a great need, but we're overcoming historical obstacles and really providing a path to the future. So we look forward to the announcement. I thank you for your attention and for supporting our effort. Allison, back to you.
Okay, thank you so much, Bennett. We're going to begin in just a minute with the main part of our webinar presentation today. So let me introduce our guest speaker, Dr. Elliot Goodman. Dr. Goodman grew up in England and earned his undergraduate degree in medical education from Cambridge University. He moved to the U.S. in 1990 and trained in general surgery at Maimonides Medical Center in Brooklyn. He was a research fellow at Columbia University from 1992 to 94, and after completing his training, he joined the surgical faculty of the New Jersey Medical School. Since then, he's been on the faculty of the Albert Einstein College of Medicine and the Icahn School of Medicine at Mount Sinai. Dr. Goodman is also a visiting professor at 2 medical schools in Israel, Bar Ilan University and Ben Gurion University. So, Elliot, take it away.
Thank you very much. Thank you, Alison, for the introduction. Thank you for the invitation to speak. And more generally, I'd like to thank MFA, Alison, Bennett, and Georgette for allowing me to act as an ambassador for the efforts of Ziv in the United States to put out the good word about the great things happening in Tzfat, and also for allowing me to try and raise some funds for those efforts. A quick introduction. As Alison said, I'm based at Mount Sinai. I've been in practice now for 20-odd years as a general surgeon. About 2.5 years ago, I was invited to become a visiting professor of surgery at the new medical school in Tzfat, which is, as you'll see, in the north of Israel, Bar Ilan University. And I began to teach online, and every few months I'd go to Tzfat, to the hospital, and teach the medical students. And through those teaching efforts, I was introduced to the administration of the hospital, the surgeons, and the ER staff at the hospital, and they were very proud and took great delight in telling me about their efforts with regards to victims of trauma from Syria. And essentially became, as I said, an ambassador so that I might help them promote the hospital and all the good efforts here in the United States, in Canada, and in the United Kingdom. So what I'm going to say now is based on my observations and conversations. I have yet to actually become a clinician at the hospital, though I have applied for an Israeli medical license, and hopefully one day soon I'll be directly involved in these efforts. So this slide here just shows where Tzfat is. It is in the Upper Galilee. It's very near to the Golan Heights, and as you can see, it's very near to the borders between Israel and Lebanon. It's only 7 miles from the Lebanese border, and as you go up in a more northeasterly direction, it's only about 19 miles from the border with Syria, up in the Upper Golan Heights. So it is a strategically positioned hospital in terms of dealing with patients who come over the border from Syria. There are about 4 hospitals, including Ziv Hospital in Tzfat, which have dealt with trauma victims over the last 3 to 4 years. And they also include the hospital in Tiberias near the Sea of Galilee. You can see on the picture, that's Poria Medical Center. If you look over towards the left, you'll see Naharia on the Mediterranean coast. The Galilee Medical Center is based in Naharia. And then the last, or the fourth medical facility which has been involved in these humanitarian medical efforts is the Rambam Hospital in Haifa, which is the most easterly and right again on the Mediterranean coast. And the Rambam Hospital is a very big university hospital affiliated with the Technion School of Medicine. Next slide. So Ziv is a university hospital. As I said before, it's affiliated with the Bar Ilan University Faculty of Medicine. there are now 5 medical schools in Israel, and Bar-Ilan was the 5th to be established only a few years ago. It was established in late 2011. It was established because there was a need to train more medical students and doctors in Israel. There still is a deficiency of physicians within the state of Israel, and it was decided that it would be located up in the Galilee, in the north of the country, because, as in the south as well, healthcare has some challenges. If you look at life expectancy in the extreme north and extreme south, comparing it with the center of the country, life expectancy is lower, infant mortality is higher, the number of hospital beds per 1,000 head population is lower. So the idea was, by locating the medical school up in the north of the country, and it's not just located in Sfat, but it's also located in Tiberias and Nahariya, the 3 major hospitals associated with medical school. The idea was, if you put a medical school up there, then you train students in the north, they become doctors, they might be encouraged to stay and do their residency in the north and then practice in the north, and that way, by encouraging physicians to relocate to the north of the country, then healthcare would be improved. If you look at Ziv, it serves about 250,000 residents in the Upper Galilee and up further north in the Golan Heights. There are no major cities. Sfat is not a big population center, so these patients are coming from rural and urban, sort of suburban areas, really small towns, small villages. And the important thing to say is that the indigenous patients of the hospital, as against patients coming in from Syria, is a very heterogeneous patient population. If you actually have a look at the numbers, more than 50% of the patients served by Ziv are non-Jewish. There's a big Druze community up in the north of Israel, and they are very much tied in with the Druze of Syria on the other side of the border. There are Christian Arabs, obviously there are Jews, there are Bedouin as well. So it's a very mixed bag of patients, and I think that probably helps in terms of being able to then deal with patients coming in from Syria. In terms of the history, the hospital is actually owned by the government. Only about 3 or 4 hospitals are actually owned by the government in Israel. Most of the hospitals, although they are public hospitals and they accept public insurance, they're actually owned by HMOs, or they're owned by private organizations such as Hadassah in Jerusalem. But Ziv is actually owned by the government. It was first established in 1911 with some money donated by Baron Edmond de Rothschild. It was initially a typhus and a TB hospital. During the First World War, it was actually occupied by the Turks, by the Ottoman Empire. It was a military hospital during the conflict. And then after the establishment of the State of Israel, it became a government hospital. It now currently has about 350 beds. Next slide. Now, with regards to the hospital and its efforts with Syrian casualties, this slide just basically reiterates stuff that everybody knows far better than me. That in the last 6+ years, there have been at least 500,000 people killed in the conflict, many more injured. Healthcare has been decimated in Syria, with 2/3 of hospitals either completely destroyed or so severely damaged that they are inoperable. And in terms of manpower, most Syrian physicians have fled the country. So obviously the infrastructure, the medical infrastructure in the country has been completely decimated. Next slide. So the story of Ziv's humanitarian efforts starts in February of 2013, and essentially what happened is that there were 7 trauma victims, civilian trauma victims, in the south of Syria, who were very severely damaged, and essentially their carers couldn't really cope with them. There were no appropriate facilities there, and the very bold decision was made to reach out through the United Nations to Israel and see what could be done. And what happened was that the United Nations then contacted the Israeli army, the IDF, and the 7 patients were essentially sort of passed along a chain of care from the UN across the border to the IDF. The IDF then stabilized the patients and then sent them to the nearest hospital. In this situation, it was Ziv in Tzfat. Now, at first, one of the responses of the IDF up in the Golan Heights, just right by the border, was actually to set up a field hospital. And the current medical director of Ziv was the medical director of that army hospital. He was in the army for many years in the medical corps. But that was quickly closed down because it was so near to the border that there were some real safety issues. So there was a lot of potential for crossfire. So it was decided that once the patients were stabilized, they should be then definitively cared much further away from the border in a civilian and safer environment. But the UN still continues to act as a conduit for patients. And I actually had the opportunity a few months ago to have a tour of the border with one of their physicians. There's a big contingent of Indian soldiers manning a UN base, which literally straddles both sides of the border, and they have a field hospital for stabilizing casualties at the border within that base. And you can actually see from one of the hilltops where tourists can go and look at the across the border to Syria, you can actually see this base on both sides of the border. And what happens is that local communities in Syria, if they have severely injured patients or nowadays even sick patients who have non-traumatic conditions but are still require hospital admission, then the local communities will contact the medical personnel of the United Nations within this base, and then what they do is they will send out a United Nations ambulance on the Syrian side. They'll pick up and stabilize and evaluate the patients. They'll get them across the border after some triage and stabilization. Then they'll hand them off to the IDF, the Israeli army. There'll be an army ambulance on the Israeli side of the border, and then the army ambulance will take the patient to one of those 4 hospitals in the north of Israel, and it to some extent depends on their exact injuries. So, for instance, the hospital in Tzfat, Ziv, has an excellent reputation for orthopedic trauma. So recently there was a shepherd just on the other side of the border who stepped on an unexploded vintage landmine in this area. And if you actually have a look up there on both sides of the border, you'll see a lot of signs telling you about unexploded landmines which were placed there by Syria many decades ago. And because he had a near traumatic amputation of one of his legs having stepped on the mine, it was decided that he went to Ziv. On the other hand, if, for instance, a patient has a severe head trauma, there's no head injury unit in Ziv, but there is in Nahariya, at Galilee Medical Center, which is to the east, or rather to the west, rather. So that patient gets triaged to Galilee Medical Center in Nahariya. So there's some triage, and the patients end up in the appropriate medical facility. So by June of 2017, 4 and a bit years later, Ziv itself has treated about 1,000 patients. And if you look at all of the 4 hospitals I mentioned, the total number of Syrian patients treated in this humanitarian effort is close to 3,000. It's important to understand that all of the inpatient care has been funded by the Israeli government, by the Ministry of Health. And what that essentially means is that the individual hospitals provide all of this inpatient care out of their operating budgets. And if at the end of the year their operating budgets go into the red because of this extra unpaid care, which obviously is not being paid for by any insurance, organization or HMO within Israel, then the Israeli government will plug up the gap and will essentially eradicate the budget deficit for individual hospitals generated by this humanitarian effort. So the effort is funded initially by the hospital out of their operating budgets, and then the Israeli Ministry of Health will then make the individual hospitals whole at the end of the year if they get into the red because of this humanitarian effort. Next slide. So a few statistics. If you look at the 1,000 patients that Ziv has treated now in the last 4.5 years, it's a huge age range, anything from birth to 80 years. Obviously, since a vast majority of these patients are somehow caught up in the conflict and the civil war, 90% of them are male, only 10% are female, and those female patients may be just civilian victims of the conflict. The average age is 25 years old, again because the vast majority of these patients are young men of fighting age somehow involved in the conflict. But there's still 17% of 1,000, 170 patients are still children. If you look at the sort of injuries involved and the sort of treatment rendered, most of this is orthopedic work. Traumatic amputations requiring a surgical completion of an amputation because that's for a patient, as I said before, steps on a landmine. Or there are patients with terrible fractures where a limb is completely fractured from top to bottom, oftentimes with pieces of bone sticking through the skin. I mean, these are terrible, terrible injuries, but orthopedic injuries are by far and away the most common. And then there are other injuries. A lot of patients have come in with injuries to the abdomen involving the liver, the spleen, the bowel, requiring abdominal operations, bowel operations. Patients have required eye surgery. Sometimes they even have to remove the eye if there's a terrible injury to the face involving the eye. There may be fractures of the cheeks, the jaw, requiring oral surgeons to get involved. Sometimes there are injuries to the bladder and to the kidneys, requiring urologists. And occasionally there are patients with non-traumatic admissions to the internal medicine department, patients coming in with terrible asthma and seizures who can't get the medications they require and therefore need to be stabilized in the hospital. And there have been a few OBGYN patients, women coming in for labor and delivery. And so, as you can see on the last bullet of the slide, about 3/4 of the admissions are for injuries directly related to trauma sustained as a result of the conflict in Syria. 25% are non-traumatic. These patients tend to stay in for quite some time. The average length of stay is 19 days, which obviously is just an average, and there are some patients who do remain in the hospital for months and months. And as you can see, 1 in 20 patients die. So, a 5% mortality in terms of trauma is very significant. And that just, I think, speaks to the devastating severity of some of the injuries that Ziv have seen. Next slide. So this basically just shows how initially the patients come in, if they've been stabilized by the UN or by the IDF, military medical personnel on the border. They come in and they go directly to the trauma unit of the emergency room, and there's a whole team effort involved in stabilizing them and then figuring out exactly what injuries have been sustained and what needs to be done about it. The team effort will involve nurses, physicians from the emergency room, from the various surgical departments, we said before, orthopedics, ear, nose and throat, eye, urology, general surgery, and they're often working very much in the dark. They obviously they don't know too much about these patients. They don't know what the exact mechanism of injury might have been, whether it occurred. They don't know anything about their past medical history. And sometimes all they get, as you can see on the right hand of the slide, is, and this is if they're lucky, a little brief clinical history written on a piece of paper. You see this one has sort of been splattered with blood, and then it gets sort of stuffed into the clothing of the patient. So that at least in this situation, there's a little bit of clinical history in Arabic in terms of what treatment has been rendered, what's the medical history, what medications of the patient is on. But you know this is as much as you get, and in most situations you get nothing in terms of a medical history. So you have to sort of do this very much on the fly and figure out as you go along what's wrong with the patient, very much working in a vacuum. So this can be very challenging to the trauma team as the patient's admitted and stabilized. Next slide. So as I said before, 2/3 or 3/4 of the patients have orthopedic injuries, and Ziv has a chairman of orthopedic surgery by the name of Professor Alex Lerner, and in this photo he is the gentleman in the middle with the rakish moustache. And Professor Lerner was originally born, trained in Russia, then made Aliyah, moved to Israel, and a few years ago became the chairman of orthopedics at Ziv in Tzfat, and has a particular interest in orthopedic trauma. And so therefore, Ziv really has become a center of excellence and a center of training for orthopedic surgeons within Israel and from outside the country in terms of dealing with orthopedic trauma, military, high velocity type trauma. And he has done great work in terms of salvaging patients and salvaging legs when there has been significant loss and multiple complex fractures. And in this particular picture, you can see that there were two cousins, one's 10 years old and one is 6 years old. And as I said before, there are a lot of traumatic amputations because of injuries. So the 10-year-old boy on the left of the slide unfortunately lost both legs. And fortunately for his cousin, the 6-year-old on the right hand side of the slide, they were able to salvage one leg and fixate and stabilize the fractures in the other. And so one in that leg. So one of the kids at least only required a prosthesis in one leg. And I should say about the prostheses is that because only the core cost or the cost of core treatment within the hospital is borne by the hospital and ultimately by the government. Private donations are used to fund the provision of prostheses to these patients. So all prostheses are actually funded by private donations generated within Israel and outside of Israel through various charitable organizations associated with the hospital. Professor Lerner has now actually recently written a book, a textbook, summarizing all of his experience with Syrian trauma victims, and it's called Complicated War Trauma and Care of the Wounded, and it's rapidly becoming a standard textbook in military orthopedic trauma. And this is all based on his experience over the last 4 years. Next slide. So what are the challenges experienced by the hospital in the last four years? Obviously, there are many security challenges. This ambulance was transporting back to Syria some discharged patients, and they were probably jihadi combatants in the Syrian conflict. And as the ambulance went up through the Golan Heights near to some of the Druze villages there, I think the word got out that there were some potential jihadis in the ambulance, and the local, or some of the local Druze, then actually attacked the ambulance, dragged the patients out of the back of the ambulance and actually killed them. The issue was that the Israeli Druze on the Israeli side of the border felt that these jihadis were somehow involved in attacks against their Syrian Druze counterparts, often family members on the Syrian side of the border, and so therefore the patients were dragged out and killed from this ambulance. So there are security issues in terms of bringing the patients to and from the hospital. I'll mention later a clinic that the hospital has set up to deal with mainly children who have chronic issues, not necessarily related to trauma, but maybe related to asthma, seizures, diabetes, and they are they're busing patients across the border at 5 in the morning to the clinic in Ziv. And one reason they're doing it at 5 in the morning is that there is this ongoing security issue, and so by doing it all under the cover of darkness at 5 in the morning, then the potential for security problems and attacks is mitigated. There's also a security issue in the hospital. The patients in the wards are essentially isolated away from the other patients, again, in terms of maintaining security. Since they are citizens of an enemy state, since Israel and Syria are still at war with each other, then the IDF has to be responsible for their well-being, and so one way of ensuring their well-being is to essentially isolate them within the hospital. Another reason, a medical reason for isolating them, is that there's a very high incidence of very resistant infections in Syria. One reason being because of the use of antibiotics fed to animals, so that and that has bred resistance because Syrians eat the antibiotic-treated animals for meat. Milk has been treated, the cows have been treated with antibiotics, and so therefore a lot of fairly trivial infections become resistant to antibiotics in these patients. The other thing is that there has always historically been a tendency to give antibiotics to Syrian patients within Syria for, I would say, very loose reasons. So patients with the flu get antibiotics, and again, it all breeds resistance, and the medical staff at Ziv are very leery of allowing these resistant organisms to get from the population of Syrians in the hospital to the population of Israeli hospital patients, because once multi-drug resistant infections get into the main patient population, they're very difficult to treat, and they may cause unnecessary death. So isolation of the patient deals with security issues and medical issues. Next slide. The other security issues are when you're ready to take the patient back across the border to Syria. These patients do not want to be identified as patients who have been treated in Israel, because obviously Israel and Israelis are persona non grata in Syria. They are still considered the devil. So Ziv takes great effort to de-identify everything that goes back with the patients to Syria, so they cannot be identified as patients who have been treated at an Israeli medical facility. So that means the following. It means that all discharge instructions, discharge letters are written in Arabic. Obviously, there are no identifying logos on the discharge instructions, identifying them as coming from an Israeli hospital. All labels on toys and clothes have been removed so that they don't know that these items have originated from Israel. Medications are not labeled, which obviously has its own issues, but at least by not labeling medications, they cannot be traced as being from Israel. Any X-rays or CAT scans, which nowadays can be put on a CD, on a disc, are not labeled as coming from an Israeli medical facility. So again, security issues mean that you have to de-identify everything going back with the patient when the patient eventually goes across the border back to Syria. Other challenges are ethical challenges. There was one interesting case of a patient who had a fracture in his leg, and when they were fixing the fracture, they found that he also had a sarcoma, a malignant tumor of the leg. And then the question is, if that required complex, expensive surgery, chemotherapy, even sperm preservation, because of the potential use for chemotherapy, how much of that non-trauma care should be rendered to this patient as a Syrian, potentially as a jihadist, when this wasn't directly related to the initial care of his traumatic injuries. There are a lot of ethical issues with regards to how much do you do for these patients, or are you completely blind to where they came from and treat them as if they were Israeli patients who just came in through the normal route into the hospital. And there are no real guidelines in terms of how to deal with this. So the general tendency is to be as liberal as possible and really not to take into account who these patients are. You don't delve into how they were involved in the conflict, and you just treat them as if they're any other patients. There are other logistical challenges. There had been a time when 4 out of the 5 pediatric ICU beds were occupied by Syrian patients involved in this humanitarian effort, which meant that only 1 out of the 5 ICU beds at particular points in time were available for Israeli patients. So again, how are you dealing with the logistical challenges of not having enough resources for your own patients because you're dealing with the Syrian patients? Similarly, with regards to these clinics that the hospital is now running, they are at present still run during the day, which means that the clinic facilities, the clinic staff, if they're treating the Syrian patients, are not treating Israeli patients. So again, there's a logistical and ethical challenge there of, are you taking away from your own citizens to deal with the citizens of another country, and another country against whom you've been at war, at least on paper, for the last 70-odd years. And, you know, this has had a lot of political ramifications. When the hospital started to deal with these patients, the mayor of Sfat was somewhat hesitant to support this effort because he wasn't sure how it would impact upon the healthcare available to his own community. And, you know, there was some resistance initially, but by and large now, everybody in the town, in the city of Sfat, are very supportive of the hospital's efforts. Psychological challenges, it's very tough on the staff at times to deal with these patients, particularly if the staff have have somehow been involved in the conflict with Syria and Lebanon, and again, dealing with patients, particularly, let's say, young male combatants involved in the conflict who, under different circumstances, would be looking to harm you as an Israeli citizen. How do you sort of put that aside out of your mind and deal with the patient as you would any other patient? So there's some psychological stresses involved with the staff of who are involved in treating these patients. Other logistical challenges involve when you're ready to send the patient back to Syria. You've got to understand that a lot of the aftercare that is standard in Israel, standard in the United States, is just completely absent in Syria. So, for instance, diabetic patients, they won't have insulin back in Syria. They won't have insulin syringes in Syria. So you often have to send them with medications. If a patient has a bowel injury and you have to you've performed a colostomy and you need colostomy bags for these patients, there are no colostomy bags in Syria. So you have to think about that when you're treating them and when you're discharging them. Even things like wound dressings, gauze, are pretty much absent in Syria. So again, you've got to provide for all of that aftercare before the patient goes back across the border, because it's absent. And then, of course, you've got to realize that there will probably be no follow-up on that side of the border, so that you've really got to make sure the patient is completely stable before you discharge them in, across the border, because of the lack of aftercare and follow-up, which means that patients tend to stay in the hospital for a much longer period of time. And in other circumstances, you might have been able to discharge them with home care with a visiting nurse or clinic appointments with physicians. But when you don't have any of that post-discharge care, then patients have to be kept in the hospital for quite a bit longer, and that obviously adds to the length of stay, the financial burden of the hospital, and the strain on otherwise stressed healthcare resources. Next slide. So the future. What's the future for this humanitarian effort of Ziv? Obviously, Bennett mentioned this Operation Good Neighborliness, which was a major project initiated about a year or so ago by the Israeli army, by the IDF, but it was only really last month rather, that the IDF decided to make it public. And as he said before, various NGOs such as MFA through the IDF are now providing food, gasoline, medical supplies, baby formula, diapers, a whole bunch of things across the border to the communities in southern Syria. There's now talk of re-establishing a clinic by the Israeli army, perhaps staffed by physicians from America, actually, on the border, on the Israeli side of the border in the Golan Heights, to help stabilize patients before they need to be transferred to an inpatient facility such as Ziv. Ziv has this idea, and I'm trying to help them by raising funds, of establishing a rehabilitation facility, an inpatient rehabilitation facility in the Golan Heights or in the Upper Galilee, so that if a patient is ready to be discharged from the hospital but not quite ready to go back to Syria, again with the idea that we're not sure what the follow-up care is going to be there, then maybe they can go into a what we would call here a subacute facility, like an inpatient rehab facility, where for a couple of weeks before they go back, but after they've left the hospital, they can get physical therapy, they can get wound care, they can be visited by the physicians who looked after them in the hospital to make sure they're stabilized before they go back up to Syria. So we're trying to see whether we can set up a rehab facility near to Ziv, but not actually on the campus itself. And as I said before, the hospital now is developing a once weekly clinic for Syrian patients, not only to provide some follow-up for patients who are previously admitted to the hospital so that we can follow up on the wound and other post-operative aspects of the care, but also any kids, either adults, or any patients, either kids or adults, who have chronic medical conditions as against surgical conditions such as epilepsy, asthma, diabetes, etc. If they're not getting the care they need in Syria, they can come to Ziv and they can get that as an outpatient on a once a month, once a week basis. So this is all stuff that we would like to do in the future, and obviously it will be great if Ziv, which is now an affiliate of MFA, can work with MFA to continue to treat these patients and then actually expand the scope of the treatment, not just providing inpatient care, but providing post-discharge care and chronic outpatient care. That's the presentation. Any questions?
Elliot, thank you so much. As Elliot said, we're going to open it up for questions right now. Just a quick reminder, I do have a couple of questions already, but just a quick reminder to look for that hand icon on the side of the dialog box, and you just press that. That will raise your hand, or send it to me in the chat box. So I'm going to go ahead and open it up with Isabella, who had a question. Go ahead, Isabella.
So I was just wondering, you were talking about documentation. I'm assuming that includes newborns and birth certificates. Is the infrastructure in Syria, is it set up so when they go back they can have easy access to a birth certificate if there's a newborn?
That's an excellent question, and I don't know, I'll be honest, because, as a dumb surgeon, I don't know too much about babies other than my 7 kids. So I don't know, but it would be I think it would be a very sensitive subject, I guess, to have an Israeli birth certificate for a kid born in Israel who then goes back to Syria. So that's an excellent question. I don't know. I mean, this whole idea of what is the status of these patients when they're in Israel is a whole discussion point on itself, because obviously there are no diplomatic relations between the two nations. They are still at war, and so therefore, and these patients are not refugees, right? They're not asylum seekers. So when they're brought over to Israel and end up in the hospital, they're still sort of, I guess, wards of the IDF. The IDF the Israeli army is responsible for them and provides them with security and sort of, doesn't really allow them to sort of, roam around afterwards when they're ready to leave. I mean, so the responsibility of the Israeli army, and it's a very gray area. So if you happen to be in that, and so that gray area makes it difficult, for instance, for family members to come over. So for instance, if the patient is a kid, sometimes it's difficult to have family members accompany them, because even though exceptions are made for the patient, what's the status of the mother, the daughter, the sister, the brother of the patient, since they're not actually patients themselves? If they want to come over, how do they come over? What's their legal status when they're here in or when they're in Israel? So I think the same gray area would extend to kids born in Israel, and I don't know. That's a fascinating question, and I'm sorry to be sort of pathetic, but you know, I'll try and get an answer.
Yes, and I should say, by the way, if anyone has questions that they either we're running a little short on time, so if they don't have time to ask or they want to follow up, you're welcome to email me. I'll give you my email address at the end, and we'll Elliot will try to get those questions answered for you. So let's get a couple of more in here. I think Avi had a question. Go ahead, Avi.
Hi, Elliot. Yeah, thank you for speaking with us and telling us about the great work of Ziv Hospital. I have a question about the reception that this has gotten in Israel, and especially after Operation Good Neighbor was made public by the IDF. Do you feel like there has been generally a positive response from the Israeli public, or just kind of what have the feelings been about the IDF being involved in this kind of work, and has that changed kind of since the announcement last month?
Right. I mean, I think the truth is it's always been something that the vast majority of Israeli citizens support. And I think for a couple of reasons. I mean, I think they see this as an extension of some of the humanitarian efforts that the IDF, for instance, and Israeli hospitals have offered outside of the country. So, for instance, you know, when there have been earthquakes in Turkey and Haiti, etc., in Nepal, you know, one of the first countries to be asked and to offer help to the other country in trouble, as it were, have been the Israeli army and Israeli hospitals. So this is very much in that same sort of role of providing humanitarian help to other countries. It just so happens that instead of going out there, the patients are coming in. So I think that there's already this history of humanitarian medicine in Israel, and I also think, and this whole concept, you know, this Jewish concept of Or LaGoyim, of being a light to the nations, plays into this. That you know, that Israel often gets, I think, a lot of a big bad rap by the press out of the country. So therefore, if we could be seen to be doing this wonderful thing for the citizens of a country with us, then that will provide us with some good publicity to offset a lot of the bad publicity. And I think the army feels that if we can do this, if the Israelis can do this, and if it begins to change the hearts and minds of Syrians, so that the Jews and Israelis are no longer seen as the devil, as it were, then this might somehow soften their attitude towards Israel, and that will have a positive effect in the future. So, you know, there is some self-serving knock-on effect of providing this care, and I think that does play into why the army is doing it.
So we went a little long, and I can see a couple of people have had to drop off, which I do understand. We had said 3:30, so I'm going to bring this to a close right now. But again, I know there are some more questions. You are more than welcome to email those questions to me. My email address is allison.logie@multifaithalliance.org. That's allison.logie@multifaithalliance.org, and we're happy to get those questions answered for you. Elliot, thank you so much. This was really wonderful and interesting. Just so everyone on the webinar knows, you will receive a recording of this webinar, and we really hope that if you think it's appropriate, you'll share it broadly within your networks, share it on your social media pages. You can also look, if you've missed a back webinar that you're interested in, our last webinar you can find on our website. Go to About Us and then click on MFA News and Activities. We'll eventually put this one up there too. So hopefully this can be shared widely and we can discuss the great work of both MFA and Ziv Hospital. So thank you very much again, everyone, especially to Bennett and especially to Elliot Goodman for being with us today. Thank you.